Let us go ahead with that only because just I have returned from my uh, clinic, and when Nidhi madam told me and invited me, I was actually having it in mind to share one of my case about a psychogenic cough in a 13-year-old girl, and since it is a extempore or on the spot, I won't be presenting in the systematic way as you all present it in the slides. But in pediatric hypnosis, uh, their compliance to repeated sessions is limited. Their attention span of adolescents is quite limited. And so, in my routine practice, I try to manage it in one shot. So, that I have created a personal benchmark for me that I should be able to handle the symptom in a single go. And with practice, it is possible because the pediatric and adolescent are quite more suggestible. As we know, their hypnotic talent is high. And also, they are able to, they have better creativity. I say that, they have a less logical crusting as compared to the grown-ups and adults. So they respond to the suggestions very smoothly, very easily. Their critical thinking is limited. And as a result, with practice, it is possible to handle the symptom to a great extent in a single go. So, this is a case of a 13-year-old, and the girl otherwise is scholastically very good and is always concerned about her school attendance and scholastic performance. And on one occasion, 3 years back, she got some kind of respiratory infection where she got cough. And in psychogenic coughing in children, most of the time, it is always post-infective. There is always a history that the child got infected. But her story relates back from the corona times when coughing had become very sensitive issue, and in anybody in public is coughing, people would start run away 10 feet away. So that was where she was sensitized, and the repeated messages about the symptom of coughing or losing the sensation of the smell or having sneezing and all that is counted to be your early sign of having infection with corona. So that is where she was sensitized with that. Her father was a patient of allergic rhinitis and coughing as well. So he was taking frequently treatment for that and on seasonal basis. So from the very childhood, this girl was seeing the father having such kind of thing, and at times the parental symptoms tend to be transmitted into the child, and their body, their psyche can mimic the parental symptoms. This has been very well correlated in some of the studies in the girls with premenstrual syndrome, PMS. That when the child has seen the mother from the early childhood suffering through the symptoms during the menstruation, then when she starts menstruating, she also tries to mimic, or she has a program that this is something which cannot go so smoothly and so easily, and so she starts unknowingly having similar or same type of symptoms. So here it is about mimicking the father's symptoms and allergy. So the girl started having this symptoms some time back following the infection with the routine viral infection. It was not corona. Post corona she started having this, post-corona period, I would say. She did not contracted corona anytime, nor anybody in the family, but she was much sensitized during the corona times about this, and she was seeing father, getting allergic attacks of rhinitis and coughing. So the father used to go to various doctors and used to get treated. This girl was often on admitted on three different occasions, separated approximately 6 to 8 months, and was having a continuous bouts of coughing, which were not very severe coughing, but the symptom used to be quite disturbing, and the frequency used to be somewhere around 40 per minute, 35 to 40 per minute. So while talking, during every sentence, she used to have at least one or twice that coughing symptom. And she used to say that, I am feeling some kind of irritation in a particular area of the throat. On a few occasions, they had gone to some hill stations in Himalayas, and there also she got, because of the cold, she got again coughing. They returned back, and she had to be admitted. So there were at least three episodes of getting admitted, and off and on she used to keep getting. Recently, since last 20 days, she started getting coughing because the father got that allergic attack, and so when she was admitted earlier times, everything was done as a part of investigation. Uh, they had done the scans, they had done the endoscopy, everything to rule out that is there anything, including some kind of cancerous growth also. But everything was normal. All the other investigations which were done were all normal. No allergen was found, and she was receiving for this empirically many of the uh, treatment armamentarium, which are medical armamentarium, which is used for the treatment of such symptoms in pediatrics. So all the repeated antibiotics and antitussives or cough suppressing agents, including courses of steroid and Montelukast is one very popularly known to prevent the allergies. So whenever the father used to take, she also was given that. And in the current episode, since 3 weeks, she was being treated, and at times it used to be so severe that they had to admit her because of the continuous coughing. Her oxygen levels used to fluctuate. People have become more sensitive to this after corona. SpO2 is known to people. So otherwise, then I was studying as a student, and throughout my earlier career, people have never talked about this, and even physicians and pediatricians have never, considered that to be a significant. But now people are more aware of it. So on 2 3 occasions, it was a finding that her oxygen levels used to temporarily drop because of the bouts of coughing. Naturally, she is not able to breathe completely. So all the highest possible doses of steroids and the antitussives, they were all going on, but that is where we identified as psychogenic or psychosomatic, when in spite of all the known possible treatments going on, the symptom is not getting suppressed, or there is no relief in the symptom. The child used to go to sleep very peacefully. That was another thing, that otherwise any organic problem would go to disturb the sleep also. But the child used to get really tired because of coughing, and all the respiratory muscles, they have a limit. So because of the tiredness, she used to go to sleep very peacefully. But the moment she gets up in the morning, in some time she would start. And then at times when she used to be all right, people who are concerned used to ask, beta abhi aapka खांसी कैसा है, अभी ठीक हो गया ना? So that used to work as a reinforcement, and her mind used to again start giving her that symptom. So this is how the whole story was presented, and all the pile of files of investigations and everything. I was referred by one immunologist. So there is a specialty who are treating with allergies and all that. So one immunologist who is treating the father also for the allergy, he treated and he tried his everything best, but finally they when they are not able to get the answer, and the parents are always concerned, they always ask you ab tak theek kyun nahi ho raha hai. So then as a last resort they try something else, and so because I am known little in the pediatric world in Baroda, so they that child was referred to me, and then we started asking the story to the child and everything. Nothing much significant, but this was a symptom which was being copied from the parent. And so I usually take them to, first of all, in cuffing. I just start creating the first, we have to give the control to the child. And we need to make the child convinced that this symptom is controllable and controllable by herself. So I used to put a count. So in between the cuffing, I asked her that what makes you cough? So she said, I feel some irritation, which I have to, undergo coughing, then only I feel it. But it comes again and again. So I first told her that, this is not in the throat. This is something triggered by your mind. And as far as the mind is concerned, you can control it. So then I demonstrated that, see how you can control it. So I said that, after the cough, you will count 4 from 0 to 4, and then only you will cough next. So she started doing it. Initially, 1 or 2 attempts were up to 3 only. But then after some time, when you keep involving the child in talk, the mind gets diverted, and she started, following that. And then we started increasing the count. So up to 10. But once the count was over, immediately she used to cough, because that urge, it had become more or less an urge to cough out, rather than, because there was a belief that, as my father is having this problem, I am likely to have. And then sometimes the so-called, self-made doctors in the family, they start assigning, this can be hereditary, and this she also is having this because the father is having it. So they start, fixating this belief more strongly in the child. As a result, she was very much, having this thing going on, well established symptom. Then I took her into trance, and then I gave her the in cuffing. Those who had attended that pediatric hypnosis workshop, uh, I showed one video of one of my patient I treated, but the same technique I use that for cuffing. There is a point where there is a irritation, and you make the child imagine the ice in the hand, the snow in the hand, and that cooling sensation, and that cold and comfort, you transfer it to the throat. Routinely, I try that as a first means of handling that and creating a cooling sensation. So she had an experience of going to Manali and enjoying that snow. So initially I tried. So children, they exactly, or the subconscious mimics the experience very precisely and perfectly. So when I told her, she would have gone to that Rohtang Pass, and there is a snow over there in Manali. So I told her that, you are experiencing this, and you are there in that place. and you are playing with the snow and you are holding the snow in your hand and you are feeling that cooling sensation. So if you are feeling it, you will give me that idiomotor signal by raising one of your index finger. So for quite a time after suggestions, she was not raising it. But then I realized that she would have been using gloves. So I said that you have removed your gloves and now you are holding the snow. And tell me if you are able to feel that cooling sensation. So immediately the finger raised. So even in the trance, the subconscious is mimicking the exact scene which the child has experienced. So this we know it, but in this case, it was a learning for even me also that whenever you are taking the past existing experience, you have to verbatim narrate it. So earlier, a same kind of experience was told to me by uh, uh, Pankhuri. Yeah, Dr. Pankhuri, who is dealing with hypnoanesthesia in children, and she also had a similar experience. So I immediately recollected that, and I told her that you are removing the gloves, and now you are holding it, and she could immediately get it. But then when I transferred that to her throat, uh, she was able to get a reduction in the coughing, but during the trance also it was continuing. It was not getting zero. And so you have to keep changing, your methodology because you have to prove that, or that is my personal benchmark that I should be able to get the symptom under control. So then I changed it because she had got infection after coming from Manali. So I recollected that this will not work with her. That may not be sufficient. So then we converted that into the imagery on the seashore, and she is imagining some beautiful beach, and then she is playing over there, and with the breathing we associated the waves of the sea, and then I said that exactly the area of the throat which you are feeling there is a discomfort. You are preparing a small, mound out of the sand. So sand से वो छोटा सा घर जैसा बनाते हैं. So I said that you have created a small heap exactly of the size, and as we use in the pain management, you can assign the qualities, and then slowly you see that this is being swept away or washed away by the waves of the sea as they keep on coming. And you see that this size was exactly proportionate to the amount of discomfort you have. And slowly it is sweeping away, and you see that wave by wave, breathe by breathe, this is getting smaller and smaller. And at one point of time, you have seen that it has totally been taken away by the ocean, by the sea, and now you see the surface as totally plain. You may just touch over it and you can feel it that it has totally disappeared, and it has become totally smooth and comfortable. And so the same part in your throat is also becoming equally comfortable. And then I uh, gave her a suggestion that since your mind has learned to handle this, it has eliminated this discomfort from your thought. Now a new person is emerging. So that is very important that in children you have to always tell them that it's a new person so that they don't carry forward all the previous beliefs. So I said that now, since this point onwards, a new person is emerging out of you. And so, whenever anybody is going to inquire, because in her family there were not many people who used to keep inquiring and reinforcing. वो भूलती थी तो उसको याद दिलाते थे बेटा अभी खांसी कैसी है. So then she used to start coughing. So the new person is much more stronger and knows how to comfort herself. And you are going to tell everyone that that person is already gone, and this new person in me has got a very strong and healthy body and a comfortable sensation in the throat. So I am now healthy and I have corrected myself. So जब भी कोई पूछेगा, टीचर्स पूछेगी, तो कहना कि अब मैंने उसको कॉन्कर कर लिया है, मैंने उस प्रॉब्लम को जीत लिया है. So that is how the communication was there. Might be I might be missing some finer details, but that you have to go with the flow as and when whatever situation arises, you can keep on adding things. I go little in a very Ericksonian way, not very much structured as Sir is doing it. But with at Samatvam, we were not handling pediatric hypnosis to a good extent. We were not. We were dealing only with more of adult hypnosis, and so such cases were coming less frequently. But here I learned with my experience that that structured way, if it works, fine. But my experience, more or less, is with the spontaneous Ericksonian method only, and you just keep on modifying it with the flow and the need, and you keep checking the response of the child. But yes, fortunately, with this imagery, her coughing was gone, and she was comfortable. And then she woke up with a good smile. And then I gave her one more clenched fist technique to control her sensation. So after that, the session was over, and I then instructed the parents of not to reinforce and not to ask. Tell the family members also not to ask. And I said that you just quarantine her. Go and tell the teachers also that she is now all right, and not to discuss about this thing with her. And when someone asks, I told the girl that you have to say that I have now emerged out very strong, and I have conquered it. I have won over it. I have got all right. So that is what it worked, and now it is 1 week. But post the session, after going home, the father immediately uh, told me back, giving a good thanks, because they were suffering from 3 years, and the symptom was instantly corrected. So they had a big relief after 3 years almost. So when I was talking the parents with the child outside, the mother was really in tears that it was after 3 years, and we are seeing her cheerful, and that is the real reward which we get as a therapist. And after that, the father told, and we had kept almost every 3 days follow up. But now 1 week is over, and the girl is now routinely, she has resumed the schools, and she is now maybe sometimes it happens occasionally, because the circuit had operated millions of times. But she is now comfortable, and maybe शायद दिन में एक आध दो बार उसको याद आ जाता है. पर that is, we take it as it is more or less cured. I say that if that recurs, then you can bring her back. Sometimes there may be some unknown trigger or reinforcement which can reconnect, or when the child is feeling low, or is feverish because of any other reason, she may recall that respiratory tract infection, and she can get it. But I said that this is controllable, and we will be able to handle it again also. So with that reassurance, it is more than a week now, but the father is, every 3 days, the father is saying that she is good. So that is how we presume that hypnosis purely cured this symptom. and that is the success story. So if anybody has some questions or doubts, or I might have missed something, then you can ask me. Yeah, I think Veena madam is in waiting. We were waiting for you. So I was a filler, but I think I took up more time.
Sir, it is a very well utilized time.
Thank you.
Thank you
So
very much.
over to Veena madam. Yeah.
Thank you, sir. Good evening, everyone. I am going to talk about hypnotherapeutic intervention for childhood OCD. Next slide, please. Looking at the definition of obsessive compulsive disorder, there are three components to this disorder. One is presence of obsession, that a person is stuck at a thought, and that thought or the impulses or the images, they are intrusive in nature, they are inappropriate, and they are enough to bring a lot of distress to the person. In order to overcome or not have those thoughts, a very interesting mechanism happens wherein they tend to develop their own preventive behavior, which they think that they will be able to not have the intrusive thought if they engage in that behavior. Now, because they are stuck at an intrusive, inappropriate thought, the thought keeps coming back to them. And when it is converted into a compulsive behavior, the behavior gets repeated. So there is repetition of some behavior or absence of a desired behavior, which takes place in case of formation of OCD. Generally, adults have a good insight about what is happening is excessive, that it is inappropriate, that their behavior is not sufficient to bring the level of comfort to them. But children do not have this kind of an insight. And obsessions and compulsions, they usually get worse in case of any challenging, distressing situation or change of life events. Next slide, please. Um, Here we are looking at examples of obsessions wherein a person is completely focused upon one thought, and despite repeated measures of not wanting to think about the same thought, they still continue to have the same thought. One of the examples, a very interesting one that one of the clients told me was, if she wrote a point and there was a digit followed by that point, then the thought was someone from her family would die. And she was a school student. And because of this thought, she was unable to do her math work, any of the calculations which involved writing a digit after putting a decimal point to a number. So obsessions can be very, very intrusive, which bring a lot of anxiety to the person. Next slide, please. Compulsions, which are as a compensation to that thought that, oh, there are at the feeling state, a feeling of an emotion of guilt, that how can I think like this? A lot of distress uh, about oh, how bad the thought is, and then a lot of fear coming from what if this actually happens, and what will I do if this actually happens. And that is how on their own there is a repeated measure which comes to them that, okay, if I do this, then it will not come true. So the example that I gave you for the student who was not able to write a digit after putting a decimal point, the compulsion for her was she would pray 5 times after writing a number every single time, which involved a decimal point. Now, this would further bring uh, uh, an obstruction in performance of the task. For example, she was unable to finish her homework, math homework, and it was very, very difficult for her to write her math exams as well. But that was the rule which she was following. If there was a digit after a decimal point, she would have to pray 5 times to the god. Next slide, please. The common obsessions are fear of contamination, and there is fear of germ, dirt, chemical, illness. There is also obsessions of symmetry or exactness. I remember one client, when he would be walking on the floor, he would make sure that his foot does not fall on the line of the tile, that it should fall within the tile. That if something happens, then that symmetry is broken if he's putting his feet on the lines, the borders of the tiles on the floor, and then which will result into high level anxiety within him. There's also doubting, which involves doubting the efficiency of other people around as well. There is also doubting their own action. So something that they have been doing since many years, suddenly they are really doubtful of the efficacy of it. So for example, if they have locked the door properly, or if they have carried the keys with them, and checking again and again whether the doors, the windows are locked, whether the car is locked properly. And there are also aggressive impulses and many a times rageful behavior on part of the clients. Next slide, please. Another example for common obsessions is the accidental harm to self or to others. Um, for example, one client, he would leave from office for going to his home, and if he is driving the vehicle on his own, he would keep on checking in the rear view mirror if he has hit someone. And that kind of obsession would make him drive very slow. A distance which can be covered in 8 to 10 minutes, he would take 3 to 4 hours to reach home due to this kind of obsession. There is also obsessions coming from religion, like praying a number of times, bowing down a number of times, fear of God, and having that with an intrusive thought. Also comes that, oh my, if I seek forgiveness from the God, then whatever I have thought of will not happen. So from that aspect also, religious obsessions and compulsions come in. Next slide, please. These are very, very commonly observed. Washing and cleaning again and again, checking and counting the actions. During COVID, it so happened, one of the doctors, and they were dealing with patients, and the uh, obsession was triggered. What if I am contaminated? And his hands had turned white because of multiple washing. He would wash his hands in one day more than 400 times. His skin had gone completely dry. So we may consider occupational hazard, but the risk that the frontline warriors had also had mental health component to it. Yes, there is also checking and confirming, seeking again and again confirmation from others if one's behavior is right. Or also checking on their own if their own behavior is right. So also there is hoarding, hoarding of various articles, items, which also comes from compulsive buying. There is ordering and arranging and repeated phrases. Coming to the present case, before I begin to talk about this case, I would say that the participation of parents in this case was excellent. If they were not aware, and if they had not taken that very first step of bringing the child to a healthcare professional, something which got resolved in a matter of few months could have taken many years to be resolved. Uh, Coming to the present case, it was a 11 years old boy who was brought with the chief complaint that he was simply refusing to go to the school. He had not gone to school for 28 days straight. After that, he went for just one day. Then he had not gone to the school for 7 more days. And that is when the parents brought him to the doctor, and then the referral was made. So, in absentia, when the client was brought to me, he had already missed more than 40 days of school, which is usually not accepted by many schools. There is also this fear of writing with black ink, and he would simply refuse to write anything with black ink. But at his school, black ink was mandatory for them to use. That is why he would not write any classwork, any homework. So his schoolwork, his homework, all of it was pending. Very peculiar thing was he refused to drink water on his own. There's a lot of fear of contamination. He would drink water only when it was filled in a steel glass, which was washed 3 to 4 times in front of him by the mother, that the glass is being filled with water by the mother, and the mother would feed him. And we are talking about an 11-year-old boy who simply stopped eating and drinking on his own. This also means that if he's going to school at 7 a.m., then when he returns home at around 2:30 or 3, in between those hours, he has not had any sip of water. Coming to next, he refused to eat anything which had anything black in it. So no jeera, no rai, no tadka. If he would see anything which is black in color in his dish, he would not eat that day. There was also disturbed sleep. He was not able to sleep on his own, which he used to do earlier. So he started sleeping with his elder brother in his room. And he slept just one day, then he could not the next night. So then he asked the mother, and he started sleeping with the mother in her room. Then he could sleep again just for one night, and the following night he was not able to sleep. Now, what was the difficulty? He would continuously feel that if I'm asleep, something will happen to me. So he will not close his eyes. Further, multiple times he would pray during the day, and in the religion, they because he came from a Muslim family, he was to pray otherwise also, but he would do that excessively as compared to the parents and the grandparents, that they felt worried about what is he doing. When he was not going to the school, what was he doing? He was continuously pacing in the home. He was not sitting even for a minute. And there were intense, very, very strong, long crying spells wherein he will continuously sob holding the mother's hand, and he will not talk about what is bothering him, with the belief that whatever is the thought will become true if he talked about it. Next. The onset, how was it triggered? There were three very major incidents which had happened in a short duration. First, this boy was aiming to be a cricketer and he was training every day for the same. So before all of this began, he had a very fixed routine of going to the cricket academy in the morning and in the evening, different days schedules, and uh, he would talk with people. He had many friends. He was very um, happy boy until one day, that is his favorite cricketer passed away. He was watching something on the television and the news came, and he saw presence of Virat Kohli and other cricketers in that funeral, and he got to know that, oh, suddenly Philip Hughes is no more, which came to him as a huge shock. The second thing which happened in the consecutive days, maybe 3 or 4 days intervals, was a neighborhood kid in the same apartment who was about 5 years older than this client, maybe 15, 16 years of age. He showed a pornographic clip to him when they had gone to play at his home. And he was completely shocked by what he had seen. He came running to home and he put his face in the pillow and he started crying. And he cried for a very long duration. But that incident was not known to the parents. It was very later in the therapy process when this detail came up. And he then talked about it with his elder brother. Another major incident which had happened was the family was traveling to Udaipur, and when they were returning, just one day before their return, uh, the family friend, who was father's friend, he passed away due to heart attack, and they suddenly had to cut short their trip and they had to come back in the city. Uh, the the person was traveling with them, and when they were coming back, they were all in the same vehicle coming from Udaipur to Baroda. And constantly in that journey, this boy was gripped with the thoughts of death and dying. Next, please. Okay, before I talk about intervention, um, the formation of obsessive compulsive disorder, and we see that the person is stuck at an intrusive thought, and that thought is a very intense fear causing thought. It is not anger causing thought. The threat is very strong, often so strong that the person is unable to, or views oneself not able to deal with that thought at all. Now, in my interaction with many of these clients, what I have seen is, in case of adult OCD also, the onset happens in pre-adolescent or early adolescent years, wherein there is a huge conflict and crisis about two things, which are major life realities. One is death, and the second is sexuality of life, which they are either unaware of, they are, or they have less or improper information. So, coming to this, in the very first session, the boy was brought with mother and the grandfather. The father was not present in the first session. I had taken the history from the mother, and there were a few details which the boy refused to talk about. Like I told you, the fear of what if I voiced my concern and it became reality. But based upon the observation of grandfather and the mother, I could infer that his fears are originating from death and what he has witnessed. Also, I took a detailed routine of the client, what he does, at what time he wakes up, at what time he sleeps, what time he eats, and how all of that was altered. Please go to the next slide. In the next session, the goal setting was done, that what was the aim. I introduced hypnotherapy and I also taught deep breathing to the client. And I asked him to practice deep breathing as and when he felt any kind of discomfort, mentally, physically, emotionally, any kind of discomfort. If he was experiencing it, he was to practice deep breathing. Fortunately, in the second session, the father accompanied, and that's where I requested them, particularly the father, to impart sex education to the client because he already had some exposure, which he was not talking about until then. And the other issue was, father was so much occupied with his work that he was majorly absent from this boy's life. So there was a very specific plan made with him, with the father, that he would spend 30 minutes, 4 days in a week with his son, wherein it is going to be just father and the client present, no one else. So they worked out that routine. They started going to the garden, and slowly the father started talking about what was told to him as part of sex education during the session. In the third session, I requested to interact with the client alone. And a detailed history was taken wherein he mentioned the three major uh, incidents of the onset, two of which the parents had already informed me. And we did talk about death anxiety in that session. Particularly, he had the fear of his parents and his grandfather, he was very, very close to his grandfather. He had the fear of them passing away. Next session, please. Next slide. Yes, coming to session 4, and I asked him if he had any queries, and he did mention he raised his questions uh, about his conversations with his father, which were going on then, and the doubts that he had. We talked about that, and then because he was in pre-adolescent years. Structured hypnotherapy is not required. A simple storytelling or conversational hypnosis is more effective. Like Dr. Dave just mentioned that with the young girl, it was a session which was Ericksonian in approach, which was very, very effective. Here I narrated a story, and the story goes something like this: that there are two boys of the same age, 11 years old, and they are friends and they are going out to play in the field. So it's open field and there are plants here and there. There's this open ground, and there are also a few trees on one side, and they are playing. After a while, one of the boy is feeling tired and he feels like taking a nap, and he tells his friend that I'm sleeping under this tree. Will you keep an eye on me? If there is any threat, like any animal comes in or a snake comes in, you wake me up. And this friend says, yes, I will do that. and this boy goes off to sleep. And after few minutes, he wakes up from the sleep and he sees that his friend is playing a little far away in distance in the field. And this boy sees that he is all alone, and he gets scared and he gets furious, and he goes to his friend and he asks him, why did you not watch over me? What if something had happened to me? And the friend said, nothing happened. You are safe. You are asking me this question. There was no snake, there was no animal. And the story ends there. And in the beginning of the session, this boy had his eyes open. By the end of it, his eyes were closed, and he remained in that trance state for another about 10 minutes. And afterwards, he opened his eyes on his own. And for the first time in those 4 sessions, he had a smile on his face. And it was a smile, I would say, worth looking at. There were then follow-up sessions. 2 weeks later, the boy did not come, but the mother came. And she mentioned that he has started doing his classwork, but not doing his homework. But he has started going to the school alternate days. So one day he goes, the next day he doesn't. And the other thing was, he was saying, I'm all right now. So what is the need to meet with the therapist? I'll not go. But the mother came because she was seeing that improvement in him. Also, because of the father-son interaction, the quality of relationships and interactions in the home, in the family, had improved significantly. The follow-up session 4 weeks later, the client came and he came and he said, मैं तो आज सिर्फ बात करने आया हूँ आपसे. That was the first time he initiated a conversation, and he talked about his school experiences and his experiences with his classmates and what was going on in that tender age, how earlier that divide was not there in girls and boys, but now there was. And they were very conscious of talking with each other, and there was a kind of a rivalry. And he had started seeing all of it as normal, as part of growth now. Earlier, he used to be concerned about it, and he used to feel कि ये सब क्या है, ऐसा क्यों हो रहा है? But now he had a better acceptance for it. 3 months later, the entire family came for the session, and they talked about him going to the school regularly, him going to the tuition classes regularly, and him going to his cricket sessions also regularly. So that effectiveness had come in, and the boy was a very hard-working person. I'd say at such a young age, he was managing so many things on his own, but he was still refusing to eat anything with black ingredient in his food. He had started eating and drinking on his own, which had happened about 3 months later. 6 months later, it was only the father who reported that the interactions are going on well. And interestingly, this is very interesting for me because about 2 weeks back, he came to meet with me saying that he has passed his 12th standard and he is going abroad for his further studies, and that he doesn't have any of those issues which he had at that time. And his recovery, the entire journey, was a learning experience for me as well, because uh, when I worked with him, it was many years back, about 8 years back, and I had seen him as that one boy who was so timid, so shy, who would not speak, who was so scared. And then he was here, he was so confident and so open to talk about his life experiences. And with that, I thank you all. You can ask your questions and your remarks, please.
Like, well, madam, you are very seasoned. So, but I started literally feeling as if I'm back in 2002, 2003 into a hypnosis class of MSU, and you were teaching this to me. So, thanks for giving me that nostalgic feeling. But a very fantastic case.
Thank you, sir.
Anybody has any queries? We can please raise hand and
I would like to add one thing here.
yeah.
It is that it's difficult, actually very difficult, to see the progress in clients with obsessive compulsive disorder. That's why I said it was the parents' initiative, their participation, and it was the client's diligence. He was otherwise a very motivated person who suddenly had developed this difficulty, but this remarkable progress which was seen in him, a lot of uh, his personality is to be credited for this progress, along with hypnotherapy sessions, yes. But yes, it's difficult to see such a good progress in such less number of sessions.
One more thing was that I don't know, I might have missed it while you narrated things, but is it that OCD is more common with the perfectionist people? Perfectionism and OCD goes
Hand in
quite
hand.
hand in hand.
Hand in hand.
It actually, perfectionism is more with anxiety,
Okay,
and anxiety is at the root cause of it, and it takes various forms. OCD is one of the complex forms, but
okay,
yes, when compulsions begin, then it is actually with the number of actions, the number of activities, the repetitions, and not so much with perfection, because the repetition does not bring improvement.
okay.
Madam, this is an excellent case because we, as a mental health professionals, most of us have seen the consequences of something disorder in the life and how crippling it can become for any client and the family. And they define a lot of things with that crippled behavior, I would say. And setting client free at such an early age opens up a lot of better possibilities. A wonderful session. Thank you. Yeah, Nandish.
Yes, ma'am. It's a wonderful case, and with this case, I just want to connect one things. Like I'm having the one patient with who she is a too much perfectionist, and she wants everything is a perfection. She's a nearby, even though their coworker also going to be perfect, and she is suffering for the fear of death, and it's anxiety, it's taking in that much of it's she's having the fear of death and kind of things, and it's going to be increasing. She is having the psychosomatic symptoms also, like the chest pain, and the sometimes is the panic attacks. So what are the suggestions to cultivate the perfectionist belief, and how we change their belief?
Okay, it is going to be a little longer description, but I'll try to finish it in short. One you said was death anxiety.
Mhm.
We lost the connection.
Mhm.
Anyway, till Madam returns.
Okay.
Perfection, I have handled
Hello,
few.
am I audible?
Sorry.
Yeah, madam,
Yeah.
Yes.
you're audible now.
I'm sorry, I lost the internet connection. Am I audible now?
Yeah, you are audible, madam.
Yes.
Please.
Okay, thank you. I was saying there are a few components here. You can take a detailed history of your client. When we see perfectionism, it also comes from comparison. And many times, the comparison is done by the parents or the teachers in the growing up years when they are told that usko dekho wo aisa karta hai, tum bhi to aisa kar sakte ho, ya tum uske jaisa kyun nahi karte ho, ya tumhara kaam kitna acha hai, dusron ka bhi itna acha hota to. But these are all various forms of comparison based thinking, which because of observation we imbibe within us, and that comparison becomes an internal dialogue as we become adults. And that's where the perfectionism is rooted in comparison. So addressing that sense of comparison, and believe me, there's a difference between competition and comparison. And when you say that let go of the comparison, people will ask, then how will we compete? And the answer is very simple. What is the need to compete? If you are aiming at excellence in your own work and you continuously work towards improving your own work, because the only competition that you can ever have, effective competition, is with your own self. Rest, everyone else in the world has different genetic makeup, different exposure, different education, different excellence. So any kind of comparison with anyone else is absolutely baseless and futile. Understanding this basic concept and then arriving at the level of comfort within one's own body. And that's where deep breathing or breathing exercises, they come in. That and also anchoring is a very good technique wherein they learn to deal with a challenging situation by anchoring their positive emotions in their body. So that is something you can teach to your client.
Sure.
Unfortunately, with many of the clients, what I have observed is if there is an experience of sexual abuse or molestation in their growing up years, then in their adulthood also it comes in the form of perfectionism, that they want things very, very particular and they don't want to alienate from it. And that is something which needs to be probed. You can take the history more in detail and address those concerns with your client.
Sure. Thank you, ma'am.
Thank you,
Okay.
Dr. Veena, for such a wonderful input. Yes, Santanam sir, you had.
Yeah. Madam, at the outset, actually, I want to congratulate you for
Thank
your
you, sir.
wonderful presentation. Actually, I have something in my mind to share in this platform. So one of my, client, she is around 16 years old. She is a +2 student. She is doing the senior secondary. Now the problem is, her mother complains that she is eating very slowly. She's taking more time to finish even 1 or 2 idlis or 1 or 2 dosa. Normally, generally, her age of children, they used to take this type of items, tiffin items, within 10 minutes or 15 minutes. Whereas this girl, she's taking more than 1 hour. Even if they insist, she refuses to eat further. So this is the complaint. Now, actually, whether when we are doing different types of diagnosis, we have to go for this differential diagnosis. So yet to go for diagnosis, I felt that whether she is suffering from this compulsive disorder or she is having some kind of eating disorder. Since she is since she is an adolescent girl, whether she is suffering from anorexia nervosa, that is the reason why she doesn't want to eat or she refuses to eat more. So just actually had to do the diagnosis. Just I want to take your opinion also in this regard.
Okay, sir. Have you interacted with the client?
Yes. I have interacted. I'm interacting. It is going on.
Okay. You can probe, you can ask her what makes her take so much of time. Just an open-ended question. She may not mention on her own that she's taking a lot of time, So you can bring it up by saying that I was informed by your mother that you
Yes,
take
yes.
a lot of time. So
Correct.
what makes you do that?
Yes.
And then she may give you a reply. She may tell you a thought behind it,
Correct.
and that will give you the insight about whether it is an eating disorder or whether it is coming from OCD.
No.
And yes,
Correct.
it does
Okay.
happen because of
Yes.
high this emotional distress.
Correct.
A regressive behavior is seen in clients. Like you mentioned that perhaps a 2-year-old will take that much of time to
Correct.
just eat
Correct.
unevenly. Similarly,
Yeah.
this boy that I mentioned, he stopped eating on his own entirely. He
Yes.
stopped
Yes.
drinking also on his
Okay.
own. It
Yes.
was a very childlike behavior on his
Correct.
part. So this kind of regression does come in.
Yeah.
In a
Another
high
thing.
anxiety
Correct,
situation.
madam. Correct, madam. I agree. Another thing, actually, she takes very longer time only at home, not in the school. Actually, she used to finish her lunch in time. Whereas whenever she is eating at home, she takes very, very longer time. Even if
Is she
yeah.
watching television or something? Usually boys do that. They are
No.
watching TV or they are watching mobile and then they
Correct,
continue
correct.
to, take 2 hours.
Yeah. That is also.
That is,
But,
but girls usually don't do that.
yes.
But boys do have this habit.
No, actually, that my client is a girl, sir.
Okay.
My client is a girl. Actually, yes, sir. So I am working on her. Then let us see, madam. I will actually,
Yes.
I'll share my experience in the next
Sure.
clinical meeting. Yes, madam.
Sure.
Thank you.
So, Dr. Veena, many thanks for the presentation today and a good session. Dr. Avnish, very thanks for the extempore spontaneous presentation which you gave and the insights which you have shared.
Thank you.
Most welcome. Most welcome. Thank you so
Thank you.
much for giving this
Thank
opportunity.
each and everyone on
Yes,
behalf
sir.
of AoH for
Thank you,
attending
sir.
the program.
Thank you. Yes. Thank you.
Thank you.
We'll see you all in the next meeting, I think.
Yes, sir. Thank you, sir. Thank you
So
very much.
thank you very much.
Thank you. Sir.
Good night.
Good night.
Good night.